Hello, we are from STDB5. In this video, we would like to present our student project. The topic is post-term pregnancy, and these are the members.
I'm Wanda with student number 133. I will explain about the background of our student project about post-term pregnancy. So, what is pregnancy? Pregnancy or gestation is a period in which a woman brings a new life and is the most important and crucial stage of life because it requires more care and protection. This gestation period starts from conception to fetal development and lasts until birth. The normal gestation period lasts 40 weeks or 280 days. Pregnancy that reaches or exceeds the gestational age of 42 weeks from the last menstrual period is known as post-term pregnancy. Post-term pregnancy has a significant incidence in the global population, which is between 5 and 15%. This figure is influenced by various risk factors such as dating error, nulliparity, previous prolonged pregnancy, obesity, cephalopelvic disproportion, fetal anomaly, and male fetal sex. Postpartum pregnancy is associated with an increased risk of antepartum and intrapartum complications for both mother and fetus. This is due to increased fetal growth while the placenta is aging. Therefore, a deeper understanding of the management of postpartum pregnancy is needed. This is the formulation of problems and purpose of our student project. And this is the benefits of our student project.
Hello everyone, my name is Diahi Sutari, student number 173. By definition, pregnancy that reaches or exceeds the gestational age of 42 weeks from the last menstrual period is known as post-term pregnancy. Normally, the gestation period of a pregnant woman lasts 40 weeks or 280 days. Regarding its epidemiology, the incidence of post-term pregnancy in the global population is said to be between 5 and 15%. This range is due to the fact that the prevalence may vary depending on other variables. Currently, there is minimal data regarding the prevalence of postpartum pregnancy in Indonesia.
Hello, my name is Putri Agnes Monica with number student 100. So let me explain about the risk factor or etiology for the postpartum pregnancy, and this is the maternal risk factor. So the first or the most common risk factor is the overestimate gestational age. So for the overestimate gestational age is because of the inaccurate of the last period menstruation from the mother. So for the solution, we can do the bimanual examination in the first trimester, and we can do the ultrasonography to know the size of the uterine and also the size of the baby. And we can use the auscultation to know about the fetal heartbeat, and we can do the examine on the fetal or fundus height. And also for the second risk factor is the primiparity. Primiparity is the first pregnancy experience for the mother, and the third is the previous postpartum pregnancy or the last pregnancy from the mother is the long-term pregnancy or delayed pregnancy. And four is the obesity. Obesity is the one and only risk factor that can modifiable by the lifestyle modification or also the dietary modification. And the last is the genetic predisposition. Genetic predisposition is like the when the mother who are product from the twins or from the long-term pregnancy, it can cause the postpartum or delayed pregnancy.
So hello everybody, my name is Lalita Samalo, student number 156, and I'll tell you about the etiology and risk factors of postpartum pregnancy in babies. Several risk factors can also come from the fetus. One of them is the gender of the baby. From the research that has been conducted at the Central Lampung Hospital, it has been proved that more male babies had postpartum pregnancy than female babies. In male baby pregnancy, the mother's body response to stimuli become less sensitive. It can happen because of the low plasma cortisol level that affect the placenta. When plasma cortisol production decreases, prostaglandin production and estrogen secretion increases, and progesterone production decreases. Furthermore, oxytocin production will decrease so that the mother's contraction will be weaker and the mother's gestational age will be longer. Babies who have placental supertase deficiency can also have a postpartum pregnancy because there's no cortisol is produced properly. It is found in infants who have congenital defect. In addition, the absence of pressure on the cervical content from the Frankenhauser plexus that occurs in short umbilical cord and abnormalities in the location is thought to cause postpartum pregnancy.
My name is Putu Araredi Bramantia with student number 181. As demonstrated above, some risk factors associated with postpartum pregnancies were identified with some possible explanations. However, the pathogenesis of the condition is not yet clear. To have a better understanding of the pathogenesis of postpartum pregnancy, it is essential to understand some of the pathophysiology of parturition and try to grasp the idea of why this mechanism failed to be triggered in postpartum pregnancies, or conversely are triggered earlier in preterm labor. The mechanism of parturition include interaction between hormonal, mechanical, and inflammatory processes, in which placenta, mother, and fetus each play a vital role. Synthesis of CRH by the placenta has been related to the length of gestation. The CRH increases exponentially as the pregnancy advances and peaks at the time of labor. In women who deliver postterm, the exponential rise is slower than those delivering at term. This data suggests that postterm delivery is due to a change in the biological mechanism regulating the length of gestation. It is also possible that inherited predisposition due to polymorphism in the genes on a physiological pathway linking CRH to birth has a role in postterm pregnancy. The maternal phenotype may change the response of maternal tissues to the usual hormonal signals to birth, as may occur in the obese women. CRH can directly stimulate fetal adrenal production of DHEAS, the precursor of placental osteosynthesis. The rising oestrol driven by the CRH increases at the end of gestation more rapidly. Concurrently, the rise in maternal plasma progesterone concentration that occurs across gestation slows at the end of pregnancy or even falls. This may be due to the CRH inhibition of placental progesterone synthesis. Hence, the pro-pregnancy effect of progesterone, which is promoting relaxation, is declining as the pro-labor action of oestrol are increasing. The situation in postpartum pregnancies is unknown. It is likely to be similar in postpartum women who go into spontaneous labor or those who respond to IOL.
Hello, my name is Iwayan Bagus Abagus Putra with number 050. Today I would like to explain about the diagnosis for postpartum pregnancy that requires an accurate gestational age estimation. So the gestational age estimation in women with normal and regular menstrual cycle can be done by knowing the first day of the last normal menstrual period. Meanwhile, the gestational age estimation in women with abnormal or irregular menstrual periods can be done by ultrasonography examination with several accepted variations. The most accurate estimation based on USG examination is in the early gestation. The diagnosis is established when the gestation age is more than 42 weeks. The other methods to confirm the diagnosis of postpartum pregnancy are uterus size measurement in early pregnancy and notes consist of the first time the fetal heartbeat was heard and the baby movement in the mother's uterus was felt.
My name is Evina Gesi with student number 040H. Complication of maternal postpartum pregnancy delays the first and second stage may induce incidence of dysfunctional labor. It is related with the increase of fetal size and cephalopelvic disproportion. Increase of fetal size may develop another complications such as severe perineal trauma in the mother. Trauma leads into several cases including vaginal resection that lead into severe blood loss and sphincter disruption. Emergency cesarean section is the option if normal labor cannot occur. Second stage delay is linked with the other complications such as postpartum hemorrhage and maternal pyrexia. Psychological condition of the mother is often affected because of the prolonging of pregnancy. Maternal anxiety develops from some reasons such as worries about the baby's well-being and concern about why the labor has not yet started.
My name is Anastasia Vanetrix Segustianto, student number 138. I will explain about the fetal and neonatal complications in postpartum pregnancy. The first one is macrosomia. This can cause prolonged labor, shoulder dystocia, and cephalopelvic disproportion. The second one is meconium aspiration syndrome, and it can cause uteroplacental insufficiency, intrauterine infection, neonatal acidemia, stillbirth, and high morbidity, including temperature instability, low Apgar score, jaundice, and also feeding difficulties.
Hello, my name is Pratista and my student number is 47. So now I'm going to explain the prevention of postpartum pregnancy. Several minimally invasive techniques have been proposed to prevent formal induction and encourage spontaneous onset of labor at term, such as membrane sweeping, nipple or breast stimulation, and acupuncture. The first one is membrane sweeping. Membrane sweeping results in increased local prostaglandin production and, as a result, increased level of prostaglandin metabolites in the maternal circulation, promoting cervix ripening and the onset of labor spontaneously. Membrane sweeping has been shown in certain trials to shorten the time it takes for a woman to go into labor spontaneously, reducing the number of women who have a postpartum pregnancy. A study showed that in uncomplicated pregnancies, serial sweeping of the membrane is both safe and successful in preventing pregnancy beyond 41 weeks, lowering the frequency of postpartum pregnancy, its risk and expenses.
My name is Ayuni Putriadini, student number 141, so I will continue about the prevention. Breast stimulation has been considered as a method of inducing labor since it is thought to promote labor onset. It's a non-medical procedure that gives women more control over the induction process. However, it should not be used in high-risk women until all safety concerns have been addressed. The last one, acupuncture, and other non-pharmacological method of labor induction have good attention because many women prefer to avoid medical or surgical intervention during childbirth. Acupuncture or acupressure is recommended by traditional Chinese medicine to soften the cervix and promote uterine contraction. Acupuncture stimulation can trigger a biological process that improves uterine contractility and can increase contractility by stimulating central oxytocin release and parasympathetic uterine activity.
My name is Dias Bhaskara, student number 168, Management. As aforementioned, induction of labor is the most effective method in the management of postpartum pregnancy. In the case where pregnancy dating using expected date of delivery and ultrasound have failed, and or spontaneous labor is not achieved, and the conceiving mother enters postpartum gestation, induction of labor is performed in order to prevent fetal, neonatal, and maternal complications including morbidity. The induction of labor refers to artificial stimulation of the uterus to enter labor done by administering oxytocin or prostaglandin or by amniotomy. However, the induction of labor does not come without compromise. The procedure may cause discomfort to the mother and may require constant monitoring to avoid potential risk, such as uterine hyperstimulation, bleeding, fetal distress, failure of induction, and increase in cesarean section rates, as well as risks associated with uterine rupture in women who have undergone cesarean section. However, due to its risks, encouraging spontaneous labor at term using less invasive techniques such as membrane sweeping, unprotected sexual intercourse, nipple stimulation, and acupuncture have been proposed.
Hello, my name is Ferdinand with region number 108. Ripening pre-induction reduces risk and complications such as failed induction, fetal and maternal morbidity and mortality, and cesarean delivery. Women with Bishop score of 6 or over are more likely to enter spontaneous labor without aid, and induction has a higher chance of succeeding. Expectant management in women with favorable cervix has shown no detrimental effects on the outcome of the pregnancy. However, in women with unfavorable cervix with a Bishop score of below 6 or are experiencing a spontaneous cervical status change or cessation of expectant management, prostaglandin, which increases the activity of proteases that degrade the extracellular matrix to facilitate cervical ripening, and dilatation may be used for both ripening the cervix and stimulating the uterine contraction.
Hello, my name is Kristina Paramita Karnamaya with NIM 170. Postpartum pregnancy is a prolonged pregnancy with the incidence of 5 to 15% globally. Several risk factors of postpartum pregnancy include inaccurate calculation of last menstrual period, primiparity, previous postpartum pregnancy, malfetus, obesity, etc. Postpartum pregnancy diagnosis requires an accurate gestational age estimation, either by knowing the first day of last normal menstrual period in women with normal and regular menstrual cycles, or ultrasonography examination in women with abnormal or irregular menstrual cycles. The pathogenesis of postpartum pregnancy is not yet clear. It is suggested that Postpartum pregnancy is caused by a change in the biological mechanism that regulates gestational life. The diagnosis of postpartum pregnancy is established when the gestational age is more than or equal to 42 weeks. Postpartum pregnancy may cause several complications to the mother, from late onset hypertensive disorder, anemia, severe perineal trauma, vaginal lacerations, etc. Not only to the mother, postpartum pregnancy may also cause complications to the child, including fetal microsomia, prolonged labor, shoulder dystocia and associated complications, meconium aspiration, etc. Prevention and management methods of postpartum pregnancy include induction of labor, cesarean section, and several minimally invasive techniques such as membrane sweeping, nipple stimulation, and acupuncture. Here are our sources. Thank you.